Hello, everyone. This is again Miss Cañete, and we will be discussing about the concept integration, the summary of nursing as a science. And you have learned that nursing is a science because it is based on a systematic body of knowledge, which aims to solve nursing problems of individuals, families, and communities. And this systematic nursing process is embodied in the steps within the steps of assessment, diagnosis, planning, implementation, and evaluation. And now that you have finished all modules which discuss all the steps of the nursing process, let us now put together all these steps to create a picture on how the nursing process is being developed. By the way, before I proceed with my discussion, I would like to acknowledge Ma'am Joyce Asena, who is also our alumna. And this concept integration is actually a product of our collaboration with her contribution of some of the slides that I am using uh, in this session, in this concept integration recorded lecture. Okay, so thanks again to Ma'am Joyce Asena. So again, in summary, as what you have learned, there are 5 major steps of the nursing process, and this includes assessment, diagnosis, planning, implementation, and evaluation. And I'm sure at this point in time, you're quite very familiar already with these steps, no? And yun nga, in summary, assessment is a process where we collect, organize, validate, and document clients' data. And after assessment, diagnosis comes next. And this is where we analyze and synthesize and then interpret data that we have collected during the assessment process so that we can identify the client's health problems, the client's concerns and needs. And after careful analysis of client's problems and prudent prioritization of such problems, the nurse can now move to the next step, which is planning, to establish goals and objectives that aims to prevent, reduce, or resolve identified nursing problems. The fourth step of the nursing process is the implementation, where the nurse carries out the planned interventions to meet the goals and objectives, and eventually to prevent, reduce, or resolve the nursing problems that we have identified. And the last step is the evaluation, which allows the nurse to measure the degree to which goals are met and also to determine the factors that contribute to goal attainment. All right. Now, to further picture out the steps of the nursing process, we have here a diagram being flashed on your screen right now that shows the steps within the steps of the nursing process. And notice that each major step have its own sub-steps, have its own steps which we need to follow so that we will be able to take care of our clients, effectively, efficiently, adequately, appropriately, and in a manner that is also acceptable to the client. Also, if you can remember from your previous discussion, that the nursing process is a sequential process, meaning we have to finish step 1 first before we move to step 2. Otherwise, the process will not be completed and will render the nursing care also erroneous. No? You cannot accurately and appropriately identify a nursing problem if you do not conduct a thorough assessment. In the same manner that you cannot deliberately plan and identify goals and objectives if you haven't appropriately identified or correctly identified the nursing problems that you need to address. Also, you cannot come up with safe, effective, efficient, adequate, appropriate, and acceptable interventions if your goals and objectives are not specific, measurable, attainable, realistic, and time-bounded. No, because your interventions are actions uh, that you carry out so that you will be able to meet the goals and the objectives that you have set, which again aims no to resolve the nursing problems. So basically, the goals and objectives directs and guides the planned interventions. Um, and there is nothing to evaluate if these actions were not carried out, no, or were not rendered to the patient. So what do we do again during the first step of the nursing process, which is the step of assessment? No? So if you remember, it is when we collect our data. No? And these data are the subjective data, the objective data. We can also gather data from reviewing health records, no? And we gather this data through methods of interview, observation, and also examination. And then after gathering the data, we organize the data, no, according to their relationship, no, to patterns, to their relevance to one another, and we make use of nursing models to help us categorize and organize these data. Okay, and also as we try to organize our data, it is also the time when we are able to determine the data gaps and inconsistencies. And so we try to validate no, these data gaps and inconsistencies with our client um, as much as possible, no, as much as necessary. And then the last step in the assessment is when we communicate no, the data with the health team through reporting, referral, and documentation. All right. So again, in doing assessment, it is very important to take note of the verbal cues of the client, no, as they imply the felt need. These subjective cues are actually what we call as the symptoms. So these subjective data can be elicited during conversation of the nurse with the client and their significant others through methods of interview, as we have mentioned a while ago. Also take note that efficiency or collecting subjective data is facilitated through the use of assessment tools, no, or standardized questionnaires, no, or institutional questionnaires that are also patterned according to a nursing model, no, which aims to elicit no the pertinent data needed from the client. Meanwhile, the objective data, as what you have learned, are those that are empirically observed, no, or gathered. So nurses need to develop the skill of being meticulous and intrusive in the observation and examination of the client. Objective data are derived from physical assessment, the use of biophysical measures such as thermometer, the sphygmomanometer, weighing scale, pulse oximeter, and the like. Also, data from records such as the laboratory and radiologic results are also considered objective data. Now, this is an example of an institutional form that can facilitate the assessment of the patient. So please take time to scan through these forms and familiarize no, the elements or components included in the assessment forms. After gathering subjective and objective data, it is also important that we check and review the patient's health records. Checking on the client's previous and existing health records will give you more details on the client's condition. Previous health conditions, such as diabetes, may not be reported by the client, and the vital signs will not explicitly show that the patient indeed has diabetes. So if the nurse failed to note this condition, the treatment and nursing care plan for the client may not be appropriate and complete. So existing health records should also be checked for any updates, such as the newly released laboratory results or new diagnosis. For example, you have a client who has a consistently low hemoglobin level in the past 3 days. If you will not check the newly released laboratory results, you won't know if the hemoglobin level has improved already or not. No? The next few slides will show you what other data can be revealed by reviewing the existing patient health records. So through the use of the forms, no, we are able to organize our data in the clinical area. Then the next step in the assessment is to verify the data, to validate the data. It is always good to verify the data, either with the client or the healthcare team. And data which we deem vague or not clear should be verified to avoid confusion. It will also help you to plan carefully and adequately for your patient if you are validating and verifying this data. The verification of the data is an opportunity for you to update what is written in the patient record because updated information is necessary to identify the relevant concerns of the client. So validating, verifying, or double checking the data is very important to make sure that the data is accurate, current, and complete, right? So be careful in making inferences about the client's condition by always referring back to the cues and then to validating these cues if it was mentioned by the client, and also to refrain from allowing our own bias and our own assumptions no from affecting the judgment about the patient's condition. So if we try to check our own biases and assumptions, this will help all the more no, in the accuracy of the cues, as well as the appropriateness of the nursing diagnosis, thus making the plan of care relevant and adequate. Okay, and we have mentioned that the last step in the assessment is communicating the data to the healthcare team. So how do we communicate the data that we have gathered? We write the assessment data no, in the chart of the patient, because writing the assessment data is very important since it will serve as a reference for you and other healthcare team members. And please take note that there are different platforms where the assessment data can be written. And this includes the nurse's notes, the vital signs sheet, no, or the TPR sheet, or the monitoring sheet, as well as the Cardex or the sheet we use for endorsement. All right. In the Institute of Nursing, the application of the nursing process in caring for any type of client is achieved through completing the nursing portfolio. Through the nursing portfolio, the student nurse is given a tool to apply each step of the nursing process in the care of the client while being given the chance to learn the broad base of nursing knowledge. Like during assessment, the student nurse organized all the collected data into the nursing portfolio, first indicating all data pertaining to the demographic profile of the patient. So the demographic profile being flashed in your screen right now are the complete details of the developing case we had in our Ed Puzzle activity, which also includes the chief complaint and the admitting diagnosis of the client. The demographic profile is then followed by the nursing health history that includes the history of present illness or the information about the client's current state of health, the medications that the client is taking, and current interventions the client is receiving at the point of data gathering. The student then writes the past health history, which includes the previous illnesses or surgeries, if any, and health practices of the patient. So again, this is the past health history of the client in our developing case, which will be further discussed to you by Dr. Bailon in his recorded lecture. This is the occupational history of our client at Ed Puzzle, as well as his family history. Other assessment data that is recorded in the nursing portfolio are data about the patterns of functioning of our client, which is anchored on Margaret Gordon's model. Gordon's patterns of functioning is the model we are currently adapting in the Institute of Nursing to help us organize and analyze our assessment data on the health patterns of the client. First on the category is the health perception, health management pattern of the client, which is now being flashed on your screen. Notice that after writing all pertinent data about this particular category, the data is interpreted, backed up by data analysis, meaning before you can come up with your interpretation of the data, the student nurse must have consulted the norms and standards, as well as the scientific literatures about the normal pattern in terms of health perception, health management that contributes to the well-being and health of the client. Hence, sufficient data analysis will allow the nurse to interpret data if they are deviating from normal, which eventually contributes to unhealthy patterns causing health concerns from the client. Also, since data analysis is based from a scientific body of knowledge, hence citations are included as an evidence of reliability. Other categories of the patterns of functioning is the nutritional and metabolic pattern that includes patterns describing food and fluid consumption relative to metabolic need of the client, as well as pattern indicators. No? Um, so it would involve diet recall, as well as noting down the amount, no, of the food and fluid that is being consumed and the corresponding um, caloric equivalent, no, of the intake. Okay. So again, the nutritional and metabolic pattern is analyzed and interpreted. Then next is the elimination pattern, no, that describes the pattern of excretory function of the bowel, the bladder, and the skin. And through this pattern, the student nurse determines the regularity, the quality, and the quantity of stool and urine, and some related data pertaining to elimination pattern. Next is the activity and the exercise pattern, which describes the activity level, exercise program, and leisure activities of the client, and followed by the sleep and rest pattern that describes the patterns of sleep, rest, and relaxation. Next is the cognitive and perceptual pattern, which describes the ability of the client to understand and follow directions. Also, his ability to retain information, make decisions, and solve problems. It also assesses the five senses. All right. Next is the roles relationship pattern. That describes basically the interaction patterns of the client with his significant others, with the family members or others, if present. Does he live alone? What about his family structure? And to which social groups does he belong to? Okay. Then the self-perception, self-concept pattern that describes the client's self-worth, comfort, body image, feeling state. Okay, and again, these set of data are again analyzed and interpreted accordingly. The sexuality reproductive pattern is also being examined, under the patterns of functioning to identify any problem, on the sexuality as well as reproductive pattern of the client. Is his sexual relationship satisfying? Is it appropriate to his age and his situation? Are there any problems encountered? Also during examination, if there are problems identified during pelvic examination that warrants attention, health attention. Next is the coping stress tolerance pattern that basically describes how the patient, how the client is managing stress, tolerating stress, and how is he coping. Especially if he experiences crisis, and also how does he manage, who is helping him, and were there any medications or drugs or alcohol that he is taking to relax, to cope with stress, and yeah, if there are big problems, how is he handling it? Okay. The value belief pattern is also part of the patterns of functioning. no, that basically describes the patterns of values, beliefs, including spiritual beliefs, and goals, no, that guides the client's choices or decisions, right? So those are the different categories, no, of the patterns of functioning, which we try to understand, no, when we are conducting or when we are gathering data from the client to give us a holistic view, no, of the client's health patterns. After the patterns of functioning, the next set of assessment data that is gathered through the examination method is the physical assessment from head to toe. I have captured only a part of the physical assessment data from our sample nursing portfolio, which is now being flashed on your screen. But I'm sure you're quite familiar already of the comprehensive physical assessment, no, that provides a baseline data to which we can compare the succeeding progress or changes in the client's health status. And yes, this you have learned already from your previous course on health assessment last semester. Notice also that the interpretation is backed up with data analysis with citation for real reliability. And take note that during ongoing assessment, no, focused assessment is done where the examiner focuses only on specific areas of concern that is relevant to the current problem being addressed. The next set of assessment data that is documented in the nursing portfolio, no, from our developing case, no, in the ed puzzle is the result of the laboratory or diagnostic examination that provides a reliable objective data that confirms or supports the existence of current health uh, problems. And these data are also again interpreted and analyzed. So all assessment data from the demographic profile to the nursing history with the history of present illness, past health history, the occupational and family history, to the patterns of functioning, then the physical assessment followed by the diagnostics. Now, all of these are documented in the nursing portfolio to help the students process all pertinent assessment uh, information that will enable the student nurse to apply the next step of the nursing process, which is the diagnosis. Okay? And the diagnosis is the next step, which will be the next topic in the next recorded lecture that I'm going to have. So we will cut short our recording at this time. See you on the next session, and thank you for joining me in this learning adventure.